Hey everybody, I'm Mike Ligmanowski, Senior Regional Work Comp Specialist here at CORA Physical Therapy, and we're going to go live with a thrive, not survive in the work comp space when it comes to physical therapy. So I'm just going to wait a minute before I kind of get going, see if people come on. Hi Jody, how are you? Megan! Megan, I'm actually rubbing my fingertips together right now. All right, I'll give it a couple more seconds, I think, and maybe a minute, and we'll get started. I'm looking forward to this. I think you guys will enjoy. Wendy, Carrie, Elizabeth, welcome. Please, if you guys have any questions, I like to keep this as interactive as possible. So, if you want to write something or a question, because I'm gonna get going and get rolling. But if there's anything you want to go in depth on, I'd be happy to, because I'd love to kind of answer any questions that you might have. So, other than that, I'll probably keep it pretty superficial, because I could spend a lot of time on all these topics individually, but I just want you guys to get an idea of kind of where we're at as a company and what we do and really why we do it. But if there's stuff that you feel like you want to learn a little bit more about, I'd be happy to get into that. So, all right, well, let's get started, I guess. And if people keep joining in, that's fine. I'll try to keep an eye on if people ask a question or anything like that. But really the topic of today is thrive, not survive in work comp. And obviously 2020 was a wild time for everybody, and everybody agrees with that. There's no question. So what do we do here at CORA that kind of separates ourselves in the work comp space? And so what we do is the focus on the injured worker themselves. I don't think a lot of people in the PT space really understand work comp as well as we do. With number one, clinicians don't really ever get a lot of knowledge in this space when it comes to schooling. They just see it as another treatment. They see it as another patient, when actually there's a whole lot more to this game than just an injured worker walking through the doors of CORA. What we call as players in the game. We have a lot of players inside the game of work comp, from the employer to third-party administrators and adjusters and nurse case managers and networks. And you hear all these words and you don't really know exactly who's doing what. It's all a lot of behind-the-scenes stuff. We just know who's in front of us, and that's the injured worker. And that's the most important person that's in front of us as a clinician. But looking at the big picture, you have to understand there are multiple stakeholders, and we're here to serve every one of them. So I'm not going to get into that specifically, because again, that could be a whole presentation itself. But you have to understand that the traditional pattern of physical therapy is for someone to come in with a referral or even direct access, like here in Florida. But under work comp, there's multiple stakeholders that are involved in this patient's care. So when that patient comes in for that evaluation, it's going to look a little bit different. They're going to bring a whole group of people with them, figuratively speaking. So knowing that on the front end is probably the most important. So that day of evaluation, you have to understand that these people have been told what to do, where to go, when to be there. They really haven't made a lot of the decisions that are necessary, specifically when you're thinking of physical therapy, of who their provider might be. So we do a great job of being out in the community and being involved and really working kind of the direct access space. And so people get of where to go. And so when the work comp patient comes in, they're sometimes a little bit uneasy. It's them against the world, so to speak, if you will. When it comes to the idea behind, I always use this analogy, someone who had a choice to make, they may have gone to the same doctor that injured worker went to, a renowned surgeon, and they were having a knee surgery done. This person injured themselves skiing. This person injured themselves while at work, usually through an accident. Most people are not going to work that day hoping to get injured and throw their life upside down. So although they both came from the same surgeon, they both might have waited that 2 to 3 hours. But the key is the decision making that occurred. There was a decision made by the person who hurt themselves skiing that's the surgeon that they wanted to see. They were in control of that. Whereas the injured worker, they may have been told what to do, and nobody has really listened to them. They've just kind of gone through the process. So once they get through our doors in physical therapy, we have an obligation to listen to that injured worker. What exactly happened? What's going on? There's more to this story than just an accident at work. Because when someone's injured at work, it changes their livelihood, it changes their relationships, it really flips their world upside down. And so when they come to us, we need to be the change, we need to be the light in that situation. And so what here at CORA, what we use is what we call Disarm and Engage. We want to disarm that patient that first day. The day that they come into therapy should be the time that we can spend and just say, hey, tell me what's going on. What happened? Walk me through the whole process. Let me know where you're coming from, both physically and mentally, so that we can really kind of disarm. And you see it happen that first day. You see that person kind of release when you're just sitting there quietly and allowing them to get a lot of stuff off their chest, and realize the number one thing that they realize is that you're there to help. You haven't pushed them through the system. You haven't already made preconceived notions. You're there just for their assistance and to be part of their rehab team. So once that disarming occurs of allowing them to kind of get everything off their chest, you can then begin the engage process and allow them to understand, one, why they're there, why they're seeing you, what you bring to the table, and what we're going to get accomplished in getting them involved in their therapy. With one of the biggest things that we do at eval, obviously all of you guys know goal setting and everything like that, but one of the focuses that we have is what we call essential job demands. Every job out there has what we call essential job demands, meaning what do they need to be able to do physically in order to perform that job to the best of their ability. Whether it be a sedentary position where you may be working behind a desk, or you could be a stonemason where you're lifting and carrying, pushing and pulling up to upwards of hundreds of pounds. So knowing where they're coming from is really kind of the starting point to setting up your goals, okay? Excuse me. So when we're setting up those goals, you have to remember function is the key. We need to, one, get them engaged, get them understanding what our goals are, and two, really start the process of essential job demands. We here at CORA, we don't take a passive approach with our therapy, specifically when it comes to workers' compensation. I really look at it as a sports medicine approach, kind of the back to sport, back to work mentality, if you will. And so when you're setting up those essential job demands, that's going to be the key to everything moving forward. I love that people have lives outside of work, and I truly believe in that, and a work-life balance, etc. But when someone has come to you under the workers' compensation, you have to understand that returning them to work is our number one focus. And when I say returning to work, it's not how fast can you get them back to work, it's how efficient can you get them back to work safely. That's probably the most important thing. Safety is number one and paramount when it comes to our rehab protocols. But you don't want to see how fast you can get somebody back to work just for them to have to come back and see you within a week or two. We want to be able to know that we've done everything in our abilities to get them back safely. That's really the number one thing. So a big word that you'll hear inside the work comp space when it comes to therapy is compliance. Compliance is, are you showing up to your appointments? Are you, really, at the end of the day, are you showing up to your appointment, right? Are they being compliant? If they're signing in at 2 o'clock for their 2 o'clock appointment, that's being compliant. To us here at CORA, compliance is not the number one. Commitment is more important than compliance. Just showing up to your appointment is not what's going to get you better. Committing to your therapy, which again occurs at the evaluation stage with that physical therapist, the disarming and engaging is allowing that commitment to occur. We want the injured worker to be an active participant in their rehabilitation. Our goal is not just for them to be compliant, that they show up to their appointment on time, and that they check the box that they came. We actually want them to be committed to their rehab and that we're going to be there to assist them. So once we've laid out kind of the goals, again, being essential job demands and very functional in nature, lifting, carrying, pushing, pulling, climbing, you name it, the idea behind the therapy sessions is going to be what we call here the clinical pathway. The clinical pathway, basically the idea behind it is an injured worker on that pathway from eval to discharge. There's basically 5 different areas you can go. One, the patient's going to continue in physical therapy, right? So each time they come in, they require physical therapy. And at the next progress note, that's kind of where you're coming up with. And a progress note's going to be done every 6 visits or every 2 weeks, 14 days, whichever falls first. But we need, because of those stakeholders that I discussed earlier, we need to be in constant communication with everyone with the progress or lack of progress for the injured worker in regards to all the stakeholders that are involved. So with that progress note being done every 2 weeks or every 6 visits, we're looking at continuing physical therapy, right? Returning back to the doctor. Maybe there are some red flags that come up that this might be more than we bargained for, or possible imaging or anything like that, where the doctor needs to be involved in that process. Return to the doctor. Return to work. The patient's ready. The patient is performing all essential job demands in the clinic, and is no longer really in need of skilled physical therapy. Therefore, we're going to discharge the patient from physical therapy and return them to work. And then the last 2, what we call specialty programs. The specialty programs are functional capacity evaluations and a work conditioning program. Again, I could go into great detail about each of these topics individually, but I'm just going to kind of surface both of them for you so you have a working knowledge of what's going on. So the idea is continue physical therapy, return to work, return to the doctor, or what we call a functional capacity evaluation, which usually is near the end of a rehabilitation, and we want to see moving forward, is this person going to have limitations / restrictions? We want to allow the doctor, as much decision-making and as much knowledge in that decision-making as possible for what does that return to work look like. The work conditioning program, I always call that the bridge to return to work. So skilled physical therapy is going to take you so far, and I'll use a rotator cuff repair as an example. So skilled physical therapy is going to passive range of motion, active assist range of motion, strengthening, etc. Getting that person back to activities of daily living. They can reach, they can grab, they could grab something out of the pantry. But when it comes to return to work, that patient may have to be reaching overhead for frequent to constant amounts of time, which could be 30, 40, 55 minutes inside of a given hour, up to 6 to 8 hours a day, right? So when looking at that, they have to be able to perform that to return to full duty, correct? Skilled physical therapy is only going to take them so far. That work conditioning program, really what we're looking at is that person, do they have functional range of motion, approximately 75% of range of motion, 4 out of 5 strength, and endurance tends to be a big issue there as well, that they're lacking the endurance needed to work a full day. Not only a full day, but you have to remind yourself a full week or more. So what I always talk to patients about is if I were to discharge you on a Friday from skilled physical therapy, would you be able to perform all your duties on Monday for that 40, 50, 60-hour work week? A lot of times, especially a post-op rotator cuff, like I said, that's going to be a tough thing to discharge from skilled physical therapy on a Friday and be ready to return to work full duty, no restrictions on a Monday. So that's why I call it the bridge to return to work. That person may be coming back in a light duty situation. That patient may be having some restrictions. So they're not working full duty, but the work conditioning program is there to take them from the skilled physical therapy side. They may no longer need that skilled physical therapy per se, but they're not ready to return to full duty. So that's where that work conditioning falls in. So that's our fifth point of the clinical pathway. So the idea when you're working with the injured worker on that clinical pathway, the line that I like to use is today the day to discharge. When someone comes in, you're going to be able to justify that treatment session alone, and also what does the plan of care look like moving forward through that idea. Patient comes in, you see them on the schedule, is today the day to discharge? Let's answer that question. Sometimes it's a simple no. Sometimes it's post-op rotator cuff and they're on pulleys, right? So are they ready to be discharged? No. Very simple, not hard to think about. Other times it starts to get a little gray. It's not a black and white issue. Is today the day to discharge? You're going to be able to determine, hey, they might be back working light duty, but they're not back working full duty. What does that look like? What do they need? Do they need strengthening? Do they need endurance? Do they need range of motion? All of those things are going to be assessed by physical therapists, and that's going to help determine what does that plan of care look like moving forward, and also allows efficiency of the program. Because is today the day to discharge will dictate what you want to get accomplished in your sessions. It's a very simple question with actually very simple answers when you break it down. So again, using that clinical pathway from eval to discharge, you can really use a very kind of algorithm, if you will, to manage these patients. So are they lacking range of motion? Is pain what's limiting them? We're not really looking at passive approaches to pain. We want to focus on active approaches to pain. We want to focus on active return to work. We want to focus on functional gains. So is it a range of motion issue? Is it a strength issue? Are those more going to be skilled physical therapy? Then we're continuing with physical therapy. Is it going to be more of an endurance issue where they're able to reach overhead, but they might only be able to do it 1 or 2 reps? So are they going to be able to do that as an essential job demand? If that is an essential job demand of theirs and endurance is an issue, a work conditioning program may be appropriate for that patient. Now, when it comes to that, you're also reminded all of the stakeholder. You need to be clear that there's multiple people that are involved in this claim. And not just the injured worker, but the number one thing that we want to focus on as clinicians is what are we doing that is assisting this injured worker in their safe return to work? When you have that focus, you really can't go wrong. When you decide that what I'm going to do is in the best interest of this injured worker, you can't go wrong. Following the clinical pathway, using that mindset, and deciding whether or not is today the day to discharge will help guide you from start to finish in treatment and really implementing the plan of care that you've laid out for this patient on day one when you had Disarm and Engage. It's very important. So when you tie all this stuff together, that patient coming in, right? They're walking in with a lot more going on than the average Joe, including not just stakeholders, but also a mindset. They're also coming in with they tend to be a little defensive, not all, but you have to remember you've been told what to do, where to go. You haven't really been able to share your story, and none of this usually is at fault of the injured worker. They showed up at work that day not intending to get injured, and that injury occurred most likely by an accident. And like I said, it flips their world upside down. I've been in this space for 10 plus years now, and the majority is that, the minority is what everyone thinks of the injured worker, which is really a shame, because the very small amount of people that are trying to beat the system have really given the whole program and everybody that works in it a really kind of bad reputation. So my thing is, I want to clear that up. Most people, injured workers, have been injured on an accident at work. Their world is flipped upside down. Their relationships are different. Their money, they're not getting paid nearly what they were getting paid. It's not a get-rich scheme by any means. So by the time they get to us in physical therapy, there's a lot of baggage there to unfold. And it's our job, it's our duty to be there for those people, because I truly believe that is what's going to change getting that commitment level to get that safe return to work. So it's not just a compliance issue, it's going to be gaining that commitment, and that commitment's going to happen day one. Once we've been able to disarm and engage that patient, they become committed to their rehabilitation and their return to work, and then we as a team can come together and work together with them. So it's not just us dictating to them what they're going to be doing. I want that injured worker to be an active participant in their physical therapy. So here at CORA, you're aware we are WorkTracks. Most people don't know that TRACS actually stands for something, and that TRACS is testing, rehabilitation, accessibility, communication, and knowledge. I really believe that is the kind of what differentiates us from a lot of competitors in the space. And when dealing with this, so we have all the testing protocols from pre-injury and pre-employment, if you will, all the way through to FCEs that are really kind of closing out claims and injured workers. So from testing, we go to rehab. From rehab to accessibility, we have over 200 clinics all throughout the Southeast and St. Louis and Illinois. We have communication, which is obviously what I think is probably the most important when it comes to working in the work comp space with all of the stakeholders. Communication is going to be key. In a lot of the presentations I do, I'll say there's a 5-letter word that ties all of this together. And some people raise their hand and say money. Kind of makes me laugh. That's not the word I'm thinking. The word I'm thinking is trust. You want to have a level of trust not only between the clinicians and the injured worker, but there needs to be a level of trust between the clinicians and the stakeholders, the networks, the nurse case managers, the adjusters, the employers, anybody that's also involved inside of that claim. We have to be in constant communication with, because there are a lot of moving pieces, and having the best interest of the patient, number one, will help guide us, but it's also helping us guide us in trusting what we're doing and what we're recommending to the stakeholders as to what will be the best course of action to get this patient back to full duty. And really full duty, not only for work, but full duty really brings people back to kind of clearing themselves mentally as well, gaining their confidence back, renewing relationships, etc. I know it sounds over the top, but I've been in this long enough. It is a very real thing. The injured worker, there's much more to that than just, oh, I got hurt and now I go to therapy. I really feel like we can be an active participant in a holistic approach. And then finally, knowledge. We've really focused on the knowledge of our team. And so we have specialized people, regional work comp specialists, that are actually acting as a liaison between the stakeholders as well as the injured worker, employers, etc. So we have that level of communication and knowledge to assist in everything that we do for the rehab of the injured worker. So that's really kind of it in a nutshell. I feel like sharing our mindset is a really big deal, so that you understand that an injured worker, work comp is not just a payer. To us, it's a passion. And so I just feel like if you have any questions or anything like that, I'd be happy to go in depth on any of that. But I just wanted to kind of give a surface kind of layout of what does it look like to treat the injured worker from a rehab perspective. And so if you have any questions, I'd be happy to answer. If you and anything for CORA, I'll throw out there, FCE@corahealth.com. you can reach out to us, and we can a team of us have access to that email, and we can assist you in anything that you may need in regards to the work comp space and physical therapy. So I appreciate your time. Thank you. Again, if you need anything, you know where to find me. And you can email at fce@corahealth.com. Appreciate it, guys. Thank you.